Productive Dentist Academy podcast network.
I think most dentists start out wanting to be a comprehensive dentist. I want to take really good care of my patients. I really want them to understand what's going on in their mouth. And then they get in the realm of the war zone, which is a dental practice, and you're blocking and tackling. You're trying to get people in, and you don't have enough room and hygiene to get people in, and people they reschedule, and then people are not showing for their appointments. I really think that drives you to a certain philosophy of care. You may not want to be there, and that's where the frustration lies. The dentist is frustrated because I'm not doing what I thought I was going to be doing. And I was there.
Welcome to Investment Grade Practices Podcast, where we believe private practice dentists deserve to get the lifestyle today while building an asset for tomorrow. Join your host, Victoria Peterson, to design the practice of your dreams and secure your financial independence. Let's get started.
Welcome to another edition of Investment Grade Practices. I'm your host, Victoria Peterson, here with my partner of nearly 21 years, Dr. Bruce Baird. How are you doing this morning?
I'm doing great, Victoria. How about you?
Doing great. We are launching something revolutionary. I say it's revolutionary because we looked around and we couldn't find it, so we built it. The Clinical Calibration Institute, which has been built on our philosophies of comprehensive care and time management. And now we're packaging that in a way that's accessible for not just the elite who want to hire, a boutique consultant, but for everybody, because we have this belief that patient care matters. And we want to get the word out, to this next generation of owners that you can do high quality care and not burn yourself out. So welcome to the Investment Grade Practice Podcast. I'm excited to have you here today. And what we want to talk about in this episode is how your schedule is costing you more than you think in terms of practice value. So when you go, you live your life, you do what you do, and then at some point in time, your practice will be valued. And the question is, what will it be worth? And you and I have a saying that no system, no scale, no scale, no sale. The truth is you will sell your practice. The question is, how much will it be worth? So let's talk about the role that scheduling plays in creating practice value.
Yeah, there's no question that, dentists who allow the schedule to just happen during their career, what you find is you leave so much on the table because, I always joke, it's kind of like a dartboard when people get put in your schedule. It's the front desk, they ask for an appointment, and the front desk person licks the dart and throws it on the wall and says, how about Wednesday at 3? There's no thought process behind that. And what you want, and especially, and what I found it is with a practice that's considered investment grade, they have systems. They have a system for scheduling that we call that a point well. And it actually, and it's different than just block scheduling. People talk about block scheduling all the time, sand and paper and all these different names for it.
Rock, paper,
Quicksand.
scissors.
Yeah. And so, but the bottom line is there are systems that allow you to produce at the highest levels in dentistry, and not by doing dentistry faster, but literally by having time to do proper diagnostics, to do proper treatment planning. And once you do the proper treatment planning and the proper, scheduling, that really changes everything. That makes dentistry fun. People always say, "Oh, we're going to set goals now. We're going to set all these goals. Oh, it's going to be great." And you set goals, but we find that the dentist isn't even diagnosing enough dentistry to achieve the goals. And my reasoning behind that, and I've done a lot of research and a lot of studies in this arena, is they're running behind all day. They don't have time to do a comprehensive exam because they're doing busy work. They are doing the class 2 composite and taking an hour and doing, just doing things and expecting all of a sudden the production just to show up.
Right.
And I honestly believe it's because of a rushed feeling. And it really goes back to seeing new patients and hygiene. I know that this is part of a scheduling discussion, but when you see new patients in hygiene, first of all, don't tell me you're going to spend 30 minutes with that new patient in hygiene. What you're going to do is you're going to walk in, you're going to say which tooth's hurting, and you're going to fix that one. And that determines the value of your practice over the next 40 years. Because you're a drill and fill, one tooth at a time, crown of the month club type doc.
Let's go there for a second because that was going to be one of my questions to you. Do you think that your schedule reflects your philosophy of care, or how far away you are from your true philosophy? Maybe that's where burnout comes.
Doctor, are you tired of repeating yourself with your team over and over again, and yet you still see treatment walk out the door? If so, you're not alone. The Clinical Calibration Institute, powered by Productive Dentist Academy, is an all-new online platform that unites your team around your philosophy of care, so patients can say yes with confidence and you grow with purpose. Including online curriculum with world-class faculty, monthly live mastermind sessions for each department within your practice, and an online private community, this is your home to grow. Head over to clinicalcalibration.com today to join every member of your team for one very low monthly membership fee. That's clinicalcalibration.com.
Yeah, I mean, I think and we've learned this over the last 20 plus years, is that once someone learns the philosophy of scheduling to productivity, not to time, all of a sudden they increase in their production per hour by $300, $400, $500, $800 an hour. Well, $800 an hour, not only will your practice be worth more, when it is ready to be sold, but you're going to make a whole lot more money over the next 10 years or 15 years. You're going to be taking home in the top 1% of all dentists in the country. Why? Because it supports your philosophy of care. I think most dentists start out wanting to be a comprehensive dentist. I want to take really good care of my patients. I really want them to understand what's going on in their mouth. And then they get in the realm of the war zone, which is a dental practice, and you're blocking and tackling. You're trying to get people in, and you don't have enough room in hygiene to get people in, and people, they reschedule, and then people are not showing for their appointments. I really think that drives you to a certain philosophy of care. You may not want to be there, and that's where the frustration lies. The dentist is frustrated because I'm not doing what I thought I was going to be doing. And I was there. I felt that. I mean, I finally just said, forget this. I don't know anybody in my practice because they're all coming through hygiene. I meet them for 3 minutes. I'm doing Crown of the Month Club, and I do have to do dentistry fast because there's so many of them. I mean, I've got so many people doing one thing at a time. When I changed that philosophy in the early 90s to, I want to know my patients. And the only way for me to know my patients is to bring them in and let me see them first. Let me see them. Now, that doesn't mean we don't have a system to block our hygiene 1 hour appointment after my 1 hour appointment.
Right.
So I think it really comes down to a deal where most offices just don't have the verbal skills. The front office is going, they say, I want a cleaning. And the front office is going, okay, but I want you to see the doctor. Well, I just want a cleaning. Well, yeah, I know, but you have to have a philosophy of care. And
What type of cleaning do you need? Yeah.
yeah, yeah. So Dr. Baird wants to meet you, and he does this with everybody. And then afterwards, we'll get your teeth cleaned. And then, oh, okay. Okay, well, I want to meet Dr. Baird too. I've heard about it, whatever. But that changes everything because now I'm walking in, I get to know the patient. I get to find out what their wants and needs are as far as their dental care. I go through their risk factors. I do all that. And then we schedule them appropriately for whatever treatment they need. And we do it in a way that allows me to run on schedule. 98% of the time. I don't run late at lunch, don't run late at the end of the day, and neither do the doctors that follow our philosophy. So dentistry becomes more fun. You make more revenue. And actually what we found is that a lot of the docs tend to work a half day less or a whole day less and still make more money. Well, I think that's what we were trying to.
Okay.
I
Well,
don't
let's
think.
break these down a little bit.
Yeah.
So the real pivot here is, and I know it's hard to visualize it on a podcast. It makes more sense when we're actually, doing a webinar, we're coaching and people are, coming into our learning modules because you can see how the schedule is built and engineered. But there's basically a fork in the road here. Am I going to schedule to time or am I going to schedule to productivity? And we'll talk about productivity in a second, but from a team's perspective, I'll tell you, a lot of doctors that call, they'll say, I don't have great leadership skills. I can't get my team to do X, Y, Z. And I think this is a hidden secret of leadership is that when you tell your team to schedule to time, I was an assistant, I was a hygienist, I was an office manager, and I'll tell you exactly what they're thinking. They're thinking, he runs really slow, so I'm going to give him 3 hours with that crown prep today. Or he walked in a bad mood, so I'm going to take these 3 patients off the schedule because they're sensitive and they're not going to do good. Or I won't find a way to work the emergency in because they're based on time. And believe it or not, time is an emotion. And it's flexible depending on how people feel. You adjust to that. So I think that's how the perfect day falls apart is because we should give it an hour, but the doctor takes an hour and a half. So you get that front versus back. Talk about how scheduling to productivity breaks that whole cycle.
Well, I know you spoke from the aspect of being an office manager and making appointments and everything else. Myself, speaking as a dentist, is, it's frustrating when, first of all, you don't have time to get to know your patients. You're doing the Crown of the Month Club. You're doing all these things. And so our frustration leads to us being not ideal leaders. When we're stressed, that's the worst time. So our whole philosophy is let's reduce stress, let's increase productivity, let's change the paradigm. I mean, even Dentrix has perfect day scheduling, slashes and X's, and doctor's time and assistant time. Great concept, phenomenal concept. Totally out of date and totally non-productive. It's not the way to schedule. And the doctors who have followed a philosophy of saying, setting goals and reaching those goals and understanding how taking care diagnostically with our patients. People say they have 100% case acceptance. Well, yeah, if you're doing one filling a month on a patient, you might get 100% case acceptance. But
Wait, here's 100% case acceptance. Tell me why you came in today. This tooth hurts. Great.
yeah, well, let's fix it. Yeah.
But let's not talk about the 13 other things going on.
you know, or, I can get 100% case acceptance by telling people this is what you need, this is what you'd like to have. They go, yes, I really would like to have that. Well, now let me tell you how much it is. Oh, well, wait a minute. Okay, well, now.
We'll have to say finance for a whole nother episode because it's a big blocker to scheduling.
But it's okay to tell people what they need. They came to you. Now, trying to tell somebody what they need comprehensively in a 5-minute hygiene visit is ludicrous. I mean, it's just not going to help. You're not taking care of your patients. You think you are. You've been forced into that because that's what society and dentistry tells you should do. But that's not what you should do. You should do it if that's what you want to do. There are some drill and fill docs that all they do is I don't want to get anything complex. All I want to do is drill a tooth and fix it and then go home. That's fine. That's for a certain number of dentists, great. But I think a lot of us, again, I said that before, a lot of us wanted to be a comprehensive. I want to take care of my patients at the highest level, but we don't have the system in place to do that. That's what we teach. That's what CCI is going to be talking about ongoing. That's what our productivity workshops talk about. It is, how do I set it up? How do I get my team on board? And it's not hard to get the team on board once they realize.
Makes their life easier.
Yeah, it makes their life easier. The doctor will actually work less and they'll have more time to take care of the other things that they have to
Let's
do.
talk about that work less part and give an example here. So let's say that my fee for a crown is $1,000 and my goal is to, like, national average is what, 400 an hour?
Or 75 probably, yeah.
Or 75. All right. So let's just, for easy math to start with, I'm going to be a little bit above average here, and my goal is going to be 500 an hour. Now, my team will tell me it takes me an hour start to finish to prep a tooth. So how much time, if my fee is $1,000, my goal is 500 an hour, how much time would you give that procedure?
Yeah, I mean, it's counterintuitive because we've learned only one way of doing things forever. How long does it take me? Let's schedule that amount of time. But I only have two things that I worry about in the practice. Number one is take great care of the patient. Number two is to reach my goals. So if I had $1,000 and my goal is 500, well, I schedule 2 hours in that chair. But it doesn't take you 2 hours, Dr. Baird. I know it doesn't, but I just reached my goal. Slap me upside the head if I don't connect with anything else. I mean, it's like I'm the one who set the goal. Well, that's not enough. We'll set it higher. Go 600, go 550. But whatever it is, that's the way we determine what we do. Now, another question would be what about a filling that takes us 40 minutes to do and we only charge $250 and we have a $500 an hour month? Do we only schedule 20 minutes, 30 minutes? That's tough. So when do you do those procedures that don't fall into the productivity per hour? That's when you do it next to, let's say you're doing 3 implants and the total is $3,000 or $4,000.
Yeah. But your whole, well, at 500 an hour, that's your whole day.
That's your whole day. And so would you schedule them the whole day, Dr. Baird? No. Yes, I will on the schedule. Will you keep them in the chair all day? No. I will do the work as quickly and efficiently as I possible because I'm a patient. I hate being at the dentist. And if you can get it done in an hour, I'm tickled. Now, what are you going to do the next 7 hours, Dr. Baird? You reached your goal for the day. Well, you know what? I'm going to do every POS thing that I have to do, every little teeny filling, everything that doesn't fall into my systems. I look the schedule up next week. I bring things in to today. Why? So that tomorrow will be the same as today. And that's
So on days like that, and I love that you said, you could do an implant, you can do Invisalign, you could do a quadrant of dentistry, and I'm just using the simple thing of 500 an hour. Principles hold when you get up to 800, 1,000, 2,000, 3,000. It's just your service mix is a lot different at that point. But so that's column one. That patient might, or 2 patients or 3 patients might fill my whole thing. Seems like it would make checking hygiene a lot easier. You could pull things out of hygiene and make those patients happy.
when you have time to do a comprehensive exam, I don't have the studies on this, but I'm sure the data is out there somewhere. But if you're seeing people at hygiene, your average treatment plan is $2,500. If you're seeing patients in your own chair in a treatment, in the doctor's chair first, maybe your treatment planning is $7,500. You've spent 3 times more time with them, so it's $7,500. Does that mean you have to do all the dentistry at once? No. What happens to these patients? They may do a little bit of it, and then they get into hygiene and they get consistent in hygiene. Guess what? That's our hygiene annuity. It's an annuity plan. Every time we had over 500,000 a month coming through our hygiene department, but yet I had time to check all 5 hygienists during the day. How do you do that? Well, it has to be intentional. It has to be scheduled. It has to be a way that you do business. And I was able to produce towards the end of my clinical career. I was able to produce 4,000 an hour and work 2 days a week. I did that for the last 14 years, not 4,000 an hour, but the last 14 years I only worked 2 days a week. Why? Well, because I was making more money than I ever thought I'd make. I was probably making 5 times the national average, and I was only working 2 days a week. So I got to choose what I wanted. If I decided I wanted to work 4, I could have. If I decided I wanted to see this emergency patient that really needed to get a rehab done before their class reunion on Saturday. I could see them on Wednesday if I wanted. I get to rule my business. I get to rule it. But when you're running behind and you're frustrated and you're stressed, it's to me, and I did that for 15, 18 years, and it was miserable. Until I made some changes, until I decided this wasn't the best way of doing things. Just because people say it's the best, just because Dentrix has perfect day scheduling on their software, doesn't mean it's the best. It doesn't mean that's the way you should do it. It just means they did something for 95% of the dentists that use that system, which is totally inefficient. And that's why the average dentist is producing $475 an hour. I can't even imagine producing $3,600 a day. I mean, I would have a tea time at 11 o'clock every day. I would just go in, do my work, play golf every day, work 4 days a week, and I'm the national average dentist. But the national average dentist is doing $475 an hour, working their ass off all day long, seeing massive numbers of new patients that don't need dentistry. I don't want new patients. I want new patients that need what I like to do. So that's and scheduling plays a massive role in that. If you're not scheduling properly, you're not going to reap the benefits of yearly productivity, yearly profitability, and eventually the sale of your practice. It's going to make it'll make millions of dollars of difference, no question.
Well, thanks for shining some light on this because, in terms of practice value, scheduling isn't typically top of mind. But then again, most dentists, 95% cannot retire and maintain their lifestyle. That's because they think about selling their practice about a year before they want to retire. They don't realize it could take a year to get your practice in the best shape it could be, then a year to find the right buyer and actually get through the due diligence process. So it's at minimum 2 years if you don't have your ducks in a row, right? And what I'm hearing you say is scheduling isn't just a flat Stanley. It's not just a piece of paper or a dartboard where you throw some names. It's intentional. It starts with your philosophy of care, thinking through who sees the new patients first, where do they go, thinking about blocking your schedule as a provider for those new patient slots, for those emergency slots. It's engineered. It's not an afterthought. And that's what makes it a system, is that it's not just time management and X's and dashes. It's what does the patient journey look like to optimize the care? And now how much time do we need to give that?
I could take. Go ahead.
It's very, very different than what most of us have been taught about scheduling.
I mean, I could take a comprehensive dentist, somebody who is really seeing new patients first and doing things, from a comprehensive standpoint. And just by introducing scheduling,
Oh.
they will grow. They'll double their business. They'll double their practice without working any harder. It literally is that easy. And people go, "Oh, yeah, right." But we've watched it for 21 years, and it's true, and it happens. And people, that's why we're really doing CCI, because you get the opportunity to help people in a comprehensive way, not just the Crown of the Month Club. Because bottom line is, when you're doing one tooth at a time, you're not saving the patient any money. You're literally costing them a fortune. Oh, let's wait and use your insurance every year. You just cost your patient a fortune by doing that. Insurance sucks. We all know that. It only costs $1,500. And I mean, that's one crown.
Hold on to your passion for this, Bruce, because I actually want to do a second podcast with you if we could about diagnostic drift, because I think that scheduling and diagnosis go hand in hand. So let's wrap up and give them some things that they can land on about scheduling. If you met someone at the tee box today and they said, "What's the one thing that I could do with my schedule that would make a massive difference?" What would you tell them?
Number one is see your new patients in the doctor's chair. see them first. That would be the one thing. Is that a scheduling thing? Yeah, it really is, because, and all that is the verbal skills of the front desk and having a system that will allow them to come see you first. I mean, that's why they come in. Oh no, they came in for a cleaning. That's because they don't know what to ask for. So you're going to force them into a cleaning, and then your hygienists get pissed at you because, hey, you're not diagnosing the perio. And, whereas.
Well, and in today's economy where hygienists, deservedly so, are earning, 50, 60, $75 an hour, do you want to put a $45 exam in their book, right? Like we need to make sure that they're productive in their perio and things like that. So clarification on seeing the new patient first. Does that go for established family members who are bringing their kids in? Does it mean college students who may have been gone for a couple of years, but they're coming back? Like, do you segment new patients in any way?
We do. I mean, we have a philosophy that if the patient's 25 years of age or younger, they're welcome to come in to hygiene first. They rarely need a lot of dentistry, and it's real easy for me to go into hygiene and go, oh, crap, your mouth's a wreck. I don't say that, but, and then I reschedule him for a comprehensive exam with me after the hygiene. But, and the fact that marketing is so critical, the PPO practice and having them just send you a crap load of new patients does nothing to your business. I mean, yes, you get to do productive procedures at some point, but bottom line is, I believe the philosophy of care really drives the schedule. It drives everything that are we happy with what we do in dentistry? It depends, I mean, if you're happy, keep doing it. But I just felt like I needed the time to be able to talk to people. I got tired of walking down the hallway and not knowing who any of these people were. And so we just changed it. And once we changed it, everything changed.
Thank you for tuning in to this episode of Investment Grade Practices Podcast. If you find value in this episode, help us spread the word by passing it along to a dental friend, subscribe, and give us a like on iTunes or Spotify. Learn more about building your investment grade practice at productivedentist.com today.